So, did you have any class on urogenital system? Development of urogenital system? No. Did you study prostate as a viscera? No. Without these two, how can you get a class on male urethra? Because the understanding of the development is tougher. It's not so easy. Describing only parts of urethra, its cross section, will not do for you. Alright? You need to understand the development of urethra also. Okay. Just let me tell you gross anatomy fast.
within 2 minutes. Come back within 2 minutes.
Get the drawing first, all right. So this is the this is the skin. This is the skin of the scrotum. The penis. This is the trigone, bladder trigone. This is the prostate, and within the prostate there is the prostatic part of the urethra, which is most dilated. Prostatic part of urethra is most dilated. All right. Then below it is continued with the membranous urethra within the deep pouch. This is deep pouch, and within this is the membranous part of the urethra. Membranous part of urethra is the second narrowest part, and the highest narrowest part is near the slit. After this, it enters into the spongy part of the urethra within the trans-penis. Through the body of the penis, it goes towards the navicular fossa or the terminal fossa. Alright, it is almost 15 centimeter long. So this is deep pouch with sphincter urethrae membranaceae around the urethra, and the two Bartholin gland and duct on either side, right? And in the prostatic part of the urethra, there is when you see, you haven't seen the TURP, all right? TURP, transurethral dissection of prostate. When you put, yes, please. When we pass the urethroskop, cystourethroskop, where should I stop? When I am passing retrogradely passing the cystourethroskop, where should I stop? I will stop at the prostatic part of the urethra, where there is a colliculus seminalis, that is Verum and Montanum, or colliculus seminalis. There is from the posterior wall, there is a elevation, circular elevation. We will stop there. All right, where there is a blind pouch, that is called the utricle, prostatic utricle, this one, mucus diverticulum, which is similar to vagina, equivalent to vagina of the female. And on either side of the utricle, there is opening of the common ejaculatory duct. That is, this one is the seminal vesicle, this one is the seminal vesicle, and this one is the vas deferens. Both of these two ducts are joining and opening on either side of the prostatic utricle. That is the colliculus seminalis, and on either side opening of the common ejaculatory duct. This part is passing through the deep pouch. Deep pouch means superficial fascia of the urogenital diaphragm, and below is the perineal membrane. This pouch, on the posterior aspect, there is fascia of Colles, that is continuous with the dartos muscle of the scrotum. Right? This comes as a superficial perineal pouch. And from close to the trans-penis, within the deep pouch, this is transversus perineae profundus. And below the deep pouch, within the superficial pouch, this is transversus perineae superficialis. Got my point? This one at the posterior aspect, within the deep pouch, is the transversus perineae profundus. And in the superficial part, this is transversus perineae superficialis. All right. And around the urethra, there is membranous urethra, that is the sphincter urethrae membranous, in which there are two Bartholin glands, duct and Bartholin glands. This is continued, this is the bulbar spongy urethra. Then it is continued from the crus, body, and to the apex. This is continued as the spongy part of the urethra. At first, it is dilated, which is called the bulbar part of the urethra. Then it is the part in the body, then it is the part in the glans penis. Then it is continued as the part in the body, and then in the glans penis. This is the external slit. What I have said, it is important to memorize which structure is where. Then comes the description. Until and unless you can memorize which structure is where, how will you describe? It is not possible to describe. Draw the diagram in your copy. I will check it. You see, from the spongy part of the urethra, there are small urethral glands. These are simple tubular mucus glands. And these two are the bulbourethral glands with duct. This is the symphysis pubis, and it is the terminal part of the bladder trigon. It is the terminal part of the bladder trigon. All right. Can you label after this part of description? Can you label the diagram? Can you identify which structure is what? From a distance, can you identify the structure? No. What is this one? What is this one? This is the symphysis pubis. All right. It is the superficial layer. That is the skin, subcutaneous tissue. All right. This one is the bladder trigon. So the urethra commences distal to the internal urethral orifice. This one is the internal urethral orifice. From there, the preprostatic urethra comes up to the follicular seminary. Next part is up to the membranous urethra. This is the prostatic urethra. Within the membrane is the membranous urethra. Beyond the membrane, that is the spongy urethra. Spongy urethra is the bulbar part, penile part, and the terminal part. You see this part from the posterior aspect of the deep pouch. This layer is the Colles fascia. This fascia, the green layer is the Colles fascia, which is going to blend with the dartos muscle of scrotum also. This is the bulb of penis. These two are the crabs, corpora cavernosum of penis. This is glans penis, and within there is the dilated terminal fossa. Throughout the length of the spongy urethra, you will find some mucus recess, created by the mucous membrane of the spongy urethra. All right. Others are insignificant, not very much dilated. One mucus pouch, mucus recess is most important, that is within the terminal fossa, that is called the lacuna magna. That is called lacuna magna. So throughout the leg there are minute mucus recesses, one of which is larger at the terminal fossa, which is known as lacuna magna. All right, and this is covered from the front by a mucus fold. You will not be able to remember that. The name is valvulae gueri. You can remember BCG, Bacillus calvate gueri. So this is valvulae gueri. All right. Now come another process. Please come. Describe the leveling. Side. You don't know to read English?
Side.
You know. So what is the problem in describing the leveling?
So this one is the bulb of penis.
This one is the bulb of penis.
So this one.
Show them.
So this one is the bulb of penis.
Yes.
So this one is the dartos muscles of scrotum.
Which one is the dartos muscle of scrotum? Yes. Show them please.
This one.
This one is the dartos muscle. This is the bulb of penis. Next.
So this is pre-prostatic urethra.
Which one?
So this one. So this one.
From the commencement up to the collicular seminal. Then
This one is a
prostatic urethra. All right. Next. So that others can see it. He is good enough.
So this one.
I am happy with him.
Terminal fascia. So this structure.
This is the terminal fossa, yes. This is the part in the glans penis.
Yes.
Then, this is the part in the
Glans penis.
This is the part in the glans penis, and the rest of the part within the body of the penis,
Yes.
cross of bulb of the penis. All right.
Yes.
Okay. Thank you. I am happy with you. So the urethra commences from the internal urethral orifice, which is formed by the internal triangle, lower part of the internal triangle. From there up to the collicular seminalis, it is the pre-prostatic part. From the collicular seminalis up to the membranous part of the urethra is the prostatic part of urethra. From the membranous part, which is least dilatable, comes the spongy part of the urethra. And there is a dilated portion, that is the bulbar urethra, and below that is the penile part of urethra, up to the terminal fossa. Now we need to know the shape of the transverse section of the urethra. Urethra is roughly 18 to 20. Urethra is a common tubular passage for elimination of both semen and urine. It is roughly 18 to 20 millimeter in length, and at the highest breadth it is 6 millimeter in breadth. All right. If we see the passage of the urethra with cross section, we will find at the pre-prostatic urethra it is stellate. At the prostatic urethra it is crescentic. Below, at the membranous urethra, it is again irregularly stellate. And in the spongy urethra, in the bulbar part, it is trapezoid. Then it becomes, within the penile part, it becomes first as transverse slit, then inverse T-shaped slit, and there is sagittal slit at the end. So this is the transverse section of the entire urethra. Now, what is the need of such varied lumen? Varied transection of the lumen. What is the need? What does it perform? What is the need? When the urine passes, there is a double curve, double S-shaped curve. When the urine passes, there is a double S-shaped curve, so that no drop of urine is detached from the main stream. You are passing the urine, it is not that drop, urine will come out. No, it will come as a projectile stream. It will come as a projectile stream, and the individual drops will not come out. So nerve supply, arterial supply, all these things, and I will tell you a little of development also. And you should read what is hypospadias, what is epispadias, what is recto-urethral fistula, recto-vaginal fistula, all right. Ectopia vesicae. In the next day, I will teach you a little of development of urethra. All right. Today's time is not permitting. All right. Thank you all.